When Tony Abbott was in opposition, he did describe himself as the best friend of Medicare. Peter Dutton said, "I'll strengthen Medicare." Well, Abbott, Dutton and Hockey have been found to be cruel liars, and they have found to be destroyers of Medicare. They couldn't wait to plunge their knife into the back of Medicare when they gained office. And this is an absolute disgrace. There is no crisis in Medicare. There is no crisis in funding Medicare. This crisis is driven by liberal ideology and nothing more than that. It's a nonsense and it's cruel and absolutely disgraceful to think about funding future medical research by taxing those patients who are already afflicted with those diseases. It's an absolute disgrace. It's immoral for a government to try to make money out of people's illnesses, and that's what this government is doing. It's the job of government to provide stable services and quality health care for all Australians, and that's what we will demand. Our emergency departments are going to suffer horrendously when this co-payment comes in. Make no bones about it. The combination of a co-payment for a visit to your GP, for access to pathology services, for access to X-ray and other investigative services, combined with $1.8 billion being ripped out of Medicare locals, is creating the perfect storm, and it's headed for our emergency departments. They're already overcrowded, the staff there are already overworked. The New South Wales Nurses and Midwives Association is currently fighting a campaign with the state government to ensure that we get correct staff to patient ratios in our emergency departments. That is another aspect that is going to be absolutely detrimental to the nurses and the patients in this state. The best value for money in the healthcare system is derived from quality, well-funded primary health care, by keeping patients well, by keeping patients at home, by not dragging them into our emergency departments, by forcing them to come to our emergency departments because they can't afford these co-payments and these hideous taxes. You are not only costing the system more, but you are putting an indescribable cost on the patients of New South Wales. It is absolutely a disgrace. It is immoral. And the nurses and midwives of New South Wales and the nurses and midwives across Australia will fight this, and we will hold this government to account.